Hello, my friends. I am truly happy to see you again today. The topic we are going to talk about is a serious health emergency that many people still overlook. These are the early warning signs of a stroke. Did you know just a few minutes delay in recognizing the warning signs of a stroke can change the rest of your life? I have seen patients who did not recognize the signs early enough and lost the ability to walk, to speak, or even to recognize their loved ones. But I have also seen people who, because they acted fast, still walk, still smile, still live fully with their families. Today, I want to share with you the critical warning signs of a stroke, urgent messages from your body that you must never ignore. I remember Mr. James, 68 years old, from Texas. That morning, while sipping his coffee, he felt a slight numbness in his right hand, like tiny pins and needles. When he tried to talk to his wife, his words sounded strange, as if he was swallowing his sentences. He thought maybe it was because he had slept in the wrong position. Luckily, his wife had just watched a program about recognizing stroke signs. She immediately called 911. Just 35 minutes later, he was in the hospital receiving a clot-busting treatment during the golden hour. 3 months later, he walked into my clinic, shook my hand, and said, "Doctor, I beat the stroke." I will never forget those words. A stroke happens when blood flow to the brain is blocked either by a clot or by a burst blood vessel. Without oxygen, millions of brain cells die every minute. That is why we call it a race against time. The warning signs are the only alarm bell your body will ring before it is too late. There is an easy way to remember. FAST. F means face. One side of the face droops, the smile looks uneven. A means arms. When raising both arms, one drifts downward. S means speech. Slurred speech, strange words, or unable to speak. T means time. If you see any of these signs, call emergency services immediately. Do not wait to see if it goes away. Do not drive yourself to the hospital. Call an ambulance so treatment can start on the way. Every minute counts. Not all strokes look the same. Sometimes it begins with sudden loss of balance, unexplained dizziness, blurred or lost vision in one eye, or the worst headache you have ever had. I have met patients who said, "I thought I was just tired." That delay cost them their chance to recover fully. Stroke does not set an appointment, so do not gamble. I know no one likes to think about strokes, but recognizing the signs early is the greatest gift you can give yourself and your family. If you or someone you love experiences any of these symptoms, even for just a few seconds, treat it as an emergency. Call for help right away. And please share this knowledge with your spouse, your children, your neighbors. You might not just save one life, you could save an entire family from a loss that can never be replaced. Remember, when it comes to strokes, every minute, every second is worth a lifetime.